Hey guys, so welcome to my channel, StudyMedEasyn. It's been a long time I haven't made a video. I'm very sorry about that. I had exams, I had state exams. Actually, I passed everything and now I'm a doctor after 6 years. Such a hard time. Today's video is gonna be a very interesting one. I really wanted for a long time to make that video, and it's related with tricks you can do for your exams. These tricks, it's not about I study nothing and I pass. But you will realize yourself that there are very smart, cheeky tricks to help you to pass the exams. And I love them one by one. These are such an amazing tricks. Stay tuned. So guys, this is the first trick. The first trick is related with your presentation in the exam. It's the knowledge as you saw. So what I'm saying that not most of you, but a lot of you, when you're studying a lot and you go to the exam and for some reason you fail. Why you fail? I've been tutoring many students and I've realized there is only one reason you can fail when you study. It's how you express knowledge. You might have 100% of the knowledge that you need to pass the exam, but then when you go there, something happens, stress, I don't know, and you cannot express properly the knowledge. So what I want to say, first thing is the confidence. You have to be confident enough, because if you are starting saying, I'm not sure, then they will dig in that specific point and they will find that you don't know, or they make you more stressed. So you have to be confident of what you're saying. And why I'm saying that, and how it worked for me at least. When I went to the anatomy exam, I had the muscles of the foot, 13 muscles: origin, insertion, innervation, function. And I had to talk about all of them, 13 of them. So what I did, I will look confident. I started talking about the first muscle, the second muscle, the third muscle. After the fourth muscle, she stopped listening to me. Why she stopped listening to me? Because I was sure, because I looked confident and I knew what I was saying. At least I looked. And I'm sure that I might have done some small mistake, maybe in the insertion or in the function, but they didn't notice. And this can happen specifically when you have these memorizing questions. Then maybe they won't listen the mistake that you did if you look confident enough in the first and you did correct the first few things you say. So it's very important to look confident. The second thing relating with the presentation is that you need to organize the way you answer a topic. For example, if you have the anatomy of the stomach, then you can start smartly by saying where is the stomach located in the abdominal cavity. Then the external features of the stomach. Then you can go inside and talk about how the epithelium looks like. Then you can associate the stomach with the surrounding structures. And this is an organized answer. And with this way, you will look like you have them organized in your brain. Okay, so we go to the second trick. This trick, I love it. This is the best trick I ever heard of. It's from a friend of mine who told me when I was in the third year and I was getting a bit stressed with pathology and pathophysiology, and it's the smartest thing someone in medicine ever thought, after MRI maybe. So listen to this. It goes like that. You should learn how to lead your examiner in the questions you want to be asked. And what I mean by this, it means that you have a topic and you start answering and talk about a specific topic like that. An area that you know very well inside the topic, you lead a bit towards that. You open a pathway towards this subtopic and you leave it empty. You leave question marks there. So the examiner will come and ask you about this subtopic that you know it very well, but he doesn't know the examiner that you don't know. You just like making think that there is something that you don't know, but you know it perfectly. So what's the good thing about it? Every examiner wants to ask you a question about the topic. They feel the need to ask you questions. But what do? You lead them to ask you the questions that you want. And this is a very smart trick. You can use it in every exam. Because what's the point here? If you say everything 100%, he's a specialist. He can find something that you don't know for sure. So they will ask you something that you probably don't know. But if you leave an area a bit blurry, then they will ask you about the area that you left on purpose blurry. And then you'll know it. I'm going to tell you my examples about this. Is in the state exam about general medicine. It was the topic about nutrition and supplementation. There is like an adverse effect of nutrition in a malnourished patient. It's called refeeding syndrome. This is a perfect example. You study about refeeding syndrome and then you say to the examiner, you know what, there are some adverse effects in malnourished patients if you feed them. And then they will ask you about refeeding syndrome. Do you know an example of this? And then you will say, yes, refeeding syndrome. And then you smash with your knowledge, you say everything about it. So when you're studying questions for your exam, before you go to the exam, then say, this looks like a good candidate for lead, don't say more things about it, and only if they ask for it, I will. And the third trick is my trick. I invented it, I did it for the first time, and it helped me to, okay, I just got an A in stomatology. It's very tricky also, very tricky I can say almost. So what I did, and you should do also, is a search. Who will be my examiner? You cannot find your examiner, but if you know, you can use this trick. Or if you know like 2-3 of them, you can do for all of them. But for me it was easy because for some reason I knew who would be my examiner. So what I did is, I searched the examiner. I studied the examiner. I studied what papers he wrote, what research he did, what's his interest in stomatology in my example. And what I did is like, I said to myself, look Kostas, whatever question you have, you're gonna refer to something that she wrote, some research that she did, but without saying that it's her research. Just to know the answer, because you know people, in general doctors and researchers are doing research on things that they like. So if you know what they like, it's like dating. We have the same interests. So I searched about her research and I found this funny article, not funny, very serious article actually, but interesting to me also, about periodontitis and diabetes, because it combines something about stomatology that has nothing to do with me and something related with endocrinology, which I like very much. And then I studied this research very well, and I made thoughts on this research, and somehow, I don't know how I ended up there. The question was about something about the gingiva, and then I said, okay, now you have to go slowly towards the periodontitis, and I reached there, and then I talked about diabetes, and she started asking about her project. She didn't have an idea that I was talking about her project. I just like, oh, this guy knows. So that's everything for today. I'm gonna make so many videos today. I have so much free time. Stay tuned in my channel, subscribe. You can find me in Facebook with the same name. And now I want to start a project with Instagram. You can follow me on Instagram, but I haven't made anything yet. But hopefully I will do something. Thank you for your attention and good luck with your exam, and you will smash them, I'm sure.